Hi guys, it's Instagram Live. I'm armed and dangerous with April DiMaggio, my PA. It's Dr. Palm. It's Tuesday. I forgot for a second what day it was. And I think it's important that we do a little self-care. Mm-hmm. And I haven't, I think, done a laser procedure. Maybe we've done one, but I've been very remiss with my courses. So we really wanted to show you guys, since Summer Skin Rescue is live now, we're doing that virtual this year, and you can call in if you're interested in things. If you go to our website, artskinmd.com, on the blog entry or under specials, you'll see all the listings. Mm-hmm. But I wanted to show, because April is like a Voluderm and Smoothglo extraordinaire, I wanted to show you guys a combination therapy called Smoothglo, and it combines IPL. So we actually have the newest IPL device from Lumenis called Stellar, and it's a really great device. And we'll do that first on my face. So what do I struggle with? A little bit of pigmentation, I think, like all of us. I have melasma, I get some sun freckles. I used to have freckles on my nose. I got a Mount Vesuvius on my right nasolabial fold last week, a little acne spot. So it helps a little bit with some of the stains. And then I deal in my family with a little bit of rosacea. So I've got some redness on my cheeks. And I've got some little veins on the side of my cheeks that we've got a special tip that we'll talk about. So we'll do IPL first, and then we're going to do Voluderm. And do you want to explain what that is, April?
Yeah, Voluderm is radiofrequency microneedling. It's literally one of my favorite treatments. It's kind of, you get a lot of bang for your buck. You get some collagen building, some tightening of the tissue, so it helps a lot with those little fine lines that we get. And then you also get some texture improvement, so the pores that you see kind of enlarging on your nose and around your upper cheek area, it really improves with that. So I really love it. I think it's one of the best treatments that you can get. Yeah. And I actually love this machine.
Yeah, so I'm on sort of a rotation where I love doing IPL with Resurfix, which is our non-ablative laser and sort of similar to Fraxel. And then I love to alternate with this now that we have it, and then doing PRP with microneedling in my next quarter, which is like awesome way to sort of use our body's own platelet-rich plasma and help with growth factors and collagen growth. So we're going to gel me up, get some eye pads on. We're going to do an IPL first, so going after brown and red in my skin. And then we'll follow that up and do the new technology, which is this microneedling with radiofrequency that gets emitted from all the little microneedles. And that's going to help with skin texture and building good collagen, and probably even helping to a certain degree with hydration of the skin, which is what gives luminosity to the skin. So George is all ready. If she wants to sit on my lap, which she usually does, we've got her laser goggled up too. So I'm going to lean back so we get me gelled up, and you guys can have a good time. I'm usually being the one imparting fun on patients, and this time I'm going to be the one that you guys can laugh and hooray if I'm being tortured. And I sometimes flinch a little bit, even though it's not uncomfortable, so you guys can laugh at that. And please feel free, if you guys have questions about IPL technology or about this new Smoothglo or the Voluderm technology, happy to answer those as well.
I'm just looking for the iPads.
And it might be up above, and it's not there. Do you want to go to the IPL room and grab it real quick?
Yeah, I think I have to. So I think
it's
going to be one moment.
Real. So maybe what we'll do is pan over to this device, which is our Stellar device. And I think it's nice to talk about it. So not all IPLs are created equally. You know, there are machine platforms that are $30,000 machines, and there are machines that are $160,000, $180,000 machines. And you wonder, why is there a price premium on these more expensive ones? Well, it's because of the technology. And so this device has two flash pumps that is able to, these lamps are able to fire quickly and evenly. So you want to actually be able to fire that light in a steady state, so there's not a peak, so you don't overheat skin and cause things like burns, and you can put eye pads on me.
Okay.
And then secondly, we're able to adjust not only the energy, how long over a period of time it gets delivered, but also how quickly it gets delivered too. And those factors play a role in if we're going after brown in the skin, if we're going after red in the skin, what the skin tone of the patient is. So I am very light and pale. I try and be a vampire and hide from the sun, even though I'm here in San Diego. So I'm someone that we can fire a little more quickly on and use a little bit higher energy. And then the amount of energy, we tend to go up a little bit within reason with each treatment to continue to see a nice effect from it. The other nice advantage of this Stellar platform is that we have different tips on it and different filters. So the different tips, we have a large one that's kind of our workhorse, and that allows us, and you'll see April doing this, to be able to treat the single pass my whole face. And then we have two other tips, a rectangular one and a teeny little circular vascular tip that we use to get into nooks and crannies or to go after singular lesions. So like our little teeny guy, that's the circular one, I love for getting something called cherry angiomas. I don't know if you're the same way.
I do that almost every day.
Yeah, those little red spots that we tend to get on our trunk, I think it's super helpful. Today, you're going to see us do treatment. April's first going to go over with the big crystal, and then she's going to go over me with a smaller rectangular one, but using a different filter. So filters with IPL technology, they cut off a certain wavelength of energy that gets delivered to the skin. So she's going to use our workhorse with this, which is a 560 nanometer cutoff, meaning that anything from 560 nanometers or less is not going to hit my skin. So we'll treat me from about 560 nanometers to somewhere around up to 1200 nanometers of light. So that's going to get red and brown with the parameters we're using. And it's also going to build a little bit of collagen. When she switches over things, we're going to use a different filter, a vascular filter, and it does a shorter cutoff and then has a blip in the middle where it doesn't deliver that light, and then a longer wavelength that gets some of the deeper vessels. So we're going to get some of them on my cheek.
I'm going to pass you some cold air for some comfort,
so I'm gonna,
if you would like to try that.
So I'm going to be my own helper. Normally we have somebody helping both April and myself during this treatment. You guys don't have to blow the cold air.
Here on your forehead.
Perfect.
Here we go.
Here we go. And you'll see me sometimes move a little bit. This is such an easy treatment, but I'm just flinch sometimes. It doesn't hurt at all. We have protective eye pads, obviously, on the skin, and or on the eyeballs, and that's super important. You know, and what does it feel like? I mean, how do you explain it to patients?
I tell people it feels like a rubber band kind of snap.
Yeah.
And it's a little bit of heat.
Yep.
But it's really for just a millisecond you feel any discomfort.
And it's kind of like a bright flash bulb going off in the room, and a little bit of a heat rubber band snap. It's not bad. I mean, I'm a wimpy to okay patient, so if you see me flinch a little bit, that's why. It's not terrible though. We use an awesome numbing, so I mean, there are areas of the skin I'm just not even feeling anything at all. We use a mix of a 23 and 7 lidocaine and tetracaine, and I think that makes things really comfortable. I don't know, have we had any questions so far?
Not yet.
It's so nice to move for
I know,
you. You know exactly like what I want to do.
It's not my first rodeo with this.
I love it.
And, you know, on a first-time patient, you're going to see, how do you counsel patients afterwards, April?
I tell people that they're going to be a little red and swollen for an average of about 3 days. It might go away in a few hours. It might last a little bit longer if they're particularly vascular, that swelling that we can get. I just tell them really be careful to stay out of the sun. That's so important.
Yeah. And, you know, the first time you have it, if you have a lot of sun freckles or sun damage, you'll see some almost like little brown darkening spots, almost like coffee grounds, and those fall off in about a week's time.
So I'm just going to change to that little rectangular different.
So we're going to go to a smaller tip, which means it emits less energy per pulse, which actually means for the patient it's usually typically more comfortable for the patient.
And then vascular.
Yep. So we're going to hit vessels superficially and vessels a little bit deeper, which is such a unique filter for IPL systems. There's not another system on the market that's able to get superficial vessels and deep vessels with this sort of interruption of filter cutoffs, which is really cool and innovative.
I'm going to start on your chin.
Yep.
Doing okay?
Yeah, doing good. And it's a little easier, and that's because we're not putting so much energy into the skin for pulse. So that's really nice for patients. And this vascular tip is helpful we use it for teratangiomas, we use it for little blood vessels, background redness and rosacea. I think it's really helpful when people, and I've had 2 people in the last month that, similar to me, have these little kind of purplish, bluish veins on the side of their cheeks, and I am so pleasantly surprised at how well this filter cutoff does on those, because I think they're challenging. I've even had my little vessels treated with something called a long pulse YAG laser, and that's supposed to be the gold standard for these deeper vessels, and it didn't clear it with that. And we have to be careful that we don't go too strong. You can actually cause skin atrophy if you're using too aggressive of a setting. But it's really amazing with this filter cutoff. I've seen really nice improvement with some of these vessels that are a little bit deeper, more purplish on the sides of the cheeks. Yep. And obviously I'm, really careful about skincare afterwards. I don't have patients stop retinoids up to the IPL. Do you like them to stop at all?
I usually tell them a week to 3 days if they're able to do that.
Yeah, so I think, it depends on the practitioner, and that's certainly okay if you want to stop a few days beforehand. I usually hold off a few days after something like Smoothglo or Resurfix before resuming my retinoids. Sunscreen is so important. You want to use a zinc-based sunscreen so that you've got a physical blocker. I typically, for patients aftercare, if it's a female patient, I really like a tinted formulation. It's got iron oxides in it, and iron oxides help more thoroughly block things like blue light and help with just general photo damage. So I think it just gives you even a little bit better, broader coverage beyond just simple UVA and UVB, which the zinc and titanium formulations offer. So now we're done with this first treatment, right?
Yep.
So
you look nice and pink.
Good. We want to have a little bit. I get very pink from everything, so not everybody gets this pink. I get pink from the numbing. I get pink from treatment. So I just am a little bit of a sensitive peach and get that way. But a little bit of pink is fine. It can look a little bit like a sunburn and sometimes feel like it for several hours after an IPL. So I think that's good to know. And then, like we mentioned, if it's your first time, probably brown spots are going to get darker. And they'll flake off in about a week's time. You can wear, with a straight up IPL, just makeup the next morning. Usually with Smoothglo, when do you want people to resume makeup afterwards? Do you like to wait the full 24 hours?
I do.
Yeah, I do too.
I'm pretty much a stickler about that.
So that's really good to know because we're creating little micro-mechanical interruptions in the skin with needles, and you don't want to introduce something that's non-sterile like makeup there.
Yeah, you think about our brushes. We don't always clean them, as frequently as a lot of bacteria. Okay, so how did you do with that?
Fine. It was great. Nice and easy. And, some practitioners will do IPLs without numbing. And I think the rationale for that is they really want to be able for patients to register a treatment endpoint. And if something is super uncomfortable, then, probably need to turn energies down or set some of the IPL settings a little bit differently. But I'm just a big creature of comfort, and I always think about when I'm sitting here in the patient room, how do I want to be treated? And I, like I said earlier, tend to be a little bit wimpier. I would say I'm an average patient with treatment discomfort. So because of that, I really like numbing. I feel like, both April and I have been doing IPLs for somewhere between, 13 and 16 years.
Yeah, I think 16 for me now. I'm sure you want.
Yeah, so, with over a dozen, a decade and a half, basically, of experience with IPLs, I think you get very used to clinical endpoints, which you want the skin to look like. And I would rather have a patient comfortable and wanting to do an IPL again than, I've had the experience where patients have had IPLs in the past, haven't had numbing, it's been really scary and unpleasant, and they don't want to do it again. Yeah. And so building that confidence up, I think, is really important.
Okay, so I'm going to start with
Yep.
the voluderm. This is the radiofrequency microneedling device. Now you just turn slightly this right in this part on your forehead. Just going to feel some light pressure.
And this is so easy. I mean, wouldn't you say, I don't know if you've felt it, April, yet, but I mean, this
I
is
haven't.
easier than the IPL.
I'm dying to get this done though.
So talk a little bit about this. Like, who do you like to do this on?
I like to do this on some of my younger patients that might have some acne scarring.
Yep.
I think that it's very helpful at filling in those little collagen deficits or little divots that we see. And I also like to do it on patients my age, somebody in their 50s, who's starting to really see some of that laxity develop in their skin, because I really do see a good tightening from it. Also, some of our more mature patients also will come to me and they will be, very concerned about some of those really little smile lines or fine lines and wrinkling in this area, which is really just, that loss of collagen. And for them, I go a little bit more aggressive with my treatment protocol.
Yep.
But I see really great results. And there's great before and afters too that we can show patients that want to come into our consults to see what we're talking about there. So kind of every age, to be honest.
And depending on settings and what you're trying to accomplish, it may determine how many passes you do.
Yes.
What some of the settings on the Smoothglo, the Voluderm Legend Pro platform is. And the reason we call IPL with this microneedling and RF Smoothglo is really because of the skin luminosity you see with treatments. So similar to me doing a series of Sculptra on a patient's face, and we know from ultrasound studies done in the early 2000s, it builds up the dermis of the skin. So we thicken up the skin and we create this bounce back of light through different layers of the skin that just looks luminous and looks very youthful. Well, I think we're creating the same thing when we create this mechanical damage with microneedling, and at the same time simultaneously are delivering heat through these little non-insulated needles. So I think not only are we stimulating collagen, but I bet if we looked at staining and underneath the microscope of skin samples, we'd probably see a tremendous amount of hyaluronic acid actually being produced in the skin. And so what is hyaluronic acid? It's one of the more common proteins in our skin, and it loves water. It lobs onto it. It helps with hydration of the skin, and it's really what gives that beautiful glow to the skin. So I think that's probably some of the secret to this procedure as well. And I think this is great. We tend to do a pass or two around the mouth. It can help with some of those little fine lines that we all hate, those little expression lines or horizontal, vertical lines that tend to happen right around the mouth. And then in terms of recovery, I've asked patients as we've been doing this for the past several months. I can't believe it. We've had this machine, I think it's almost 6 months now. And it really is not a bad recovery. People say that they're like a little bit brawny, like a little bit pink tan the day of. But, after that, so a day afterwards, once these little microscopic holes that we're creating from the microneedling have healed in and sealed, you can wear makeup again. And I think with makeup, this is something pretty easily, and you want to see, obviously the first time you do it, make sure you don't have a big social event, like you're going to a wedding that weekend or getting photos taken or doing a big presentation at work or something that you would feel self-conscious about. But I do think it's one of those things that you could actually be pretty sneaky about, and the recovery is not bad. Sometime between probably day 3 to 5, the skin will feel a little bit sandpapery afterwards.
Like a
totally. But that's not a bad thing. It is easy to sort of come by. I'm going to be quiet for you for a second.
Just for a second. I want to get your chin really good. Get those pores.
And that's the area. Don't you feel like changes on people? And I'm so happy that you're doing this. Because we've been able to hide with masks. But man, I need it.
Okay, I'm going to have you turn over this way.
And as you guys can see, that's a quick procedure. I mean, the The microneedling is very comfortable. The company advocates that if you need to, you can do this without topical numbing, but I think with topical numbing, this is so easy. I think it's a lot easier than the IPL itself. I feel a little bit of vibration and a little tingle every once in a while, but the pressure that April is applying actually, because of something called pain gate theory, if we apply pressure, if you do feel a little discomfort, you don't feel it as much because of the pressure. So on a scale from like 1 to 10, this is like a 1. I just think it's a really easy procedure.
It is really easy.
What have your patients given you feedback as you've done this?
Well, I do microneedling every day, and I do this radiofrequency microneedling as well as using the regular pen. And my patients that have now had both since we've had this machine have told me that this particular machine, the downtime is so far less. They love the fact that they don't have anything more than maybe slight pinpoint bleeding. As you can see, you don't even really have that, and I'm using the more aggressive tip on you.
Yep, so we're going 1 millimeter down. But just because it's going 1 millimeter doesn't mean that's where it ends. I actually think the effect is deeper.
Oh, really?
Yeah, because you've got that heat being emitted, down at 1 millimeter, so it probably is reaching a radius of a little bit deeper than that. And then, this is best always similar to IPL and when we do the cervix or PRP microneedling as a series.
Yes,
so
absolutely.
I need to be on it, and we need to do our series on me. I need to, I usually am very good about, practicing what I preach, but as we all have been very busy with lots of stuff during this very unique time in history, I think I've been a little remiss with self-care, so I'm trying to get back on the bandwagon. So thankful that April is donating her time to allow me to do this.
Oh my gosh, absolutely. But I do tell patients too that a series is really necessary.
Yeah.
And once you kind of explain what's happening, then they can understand, we're creating this inflammatory event to stimulate that collagen, and we want to.
Oh,
You can hear my
Siri,
phone?
yes, Siri was chatting with us.
And it's just like other connective tissue. When you work out, you want to break it down, you want to build it back up. Let it heal, and then break it down again and build it back up. Okay, I'm just going to go over just a couple spots which I think we could use it a little bit more. Otherwise, that was it. That probably took what?
I bet 15 or 20 minutes. I mean,
10
we've been
minutes.
chatting and not going as efficiently as I think we sometimes do for patients in clinic, but just really wanted you guys to see it. I'm very open with patients about what I have done, but I also am very careful that providers such as April are the people doing stuff on me. The only thing I do in my own face occasionally is Botox or Dysport or Xeomin. I'll do a neuromodulator on myself, but I think it's important that these technologies and the injectables that we do, that you have somebody else doing it. I just think there's better safety. You're better able to appreciate all of my face, kind of in stereo, tactic sort of vision, seeing the 270 degrees of my face. And I really love that. I think, it's important to sort of keep after yourself. And how do we do that? It starts with foundational skincare. I think it also is a little bit of just soften the muscle movement with something like a neuromodulator, meaning Botox or Dysport or Xeomin. Keeping up, with appropriate either collagen stimulation or hyaluronic acid fillers with things that are considered injectables. And then doing maintenance therapy for skin tightening and helping with the skin in terms of its overall health, whether that be discoloration, so brown, whether it's redness, broken blood vessels, and then I think importantly, just the integrity of the skin and of the dermis, so helping with hyaluronic acid production, helping with collagen production, mechanically stimulating it, heating it up a little bit so that we're really challenging our skin to repair itself in a more effective manner.
And I use the elastin skin nectar on you just to kind of help soothe your skin. Also stimulate collagen. And then that was it.
That's it, you guys.
You are done.
So I probably look like a raccoon, but I am so thankful for April doing this. I hope you guys had fun on this Instagram Live. seeing me get a treatment. I think it's important I practice what I preach, and thank you, April, the
Oh, you're so
guru of
welcome.
Voluderm and Smoothglo. So today we did IPL for brown and red in the skin, then we followed that up with microneedling and RF with what is a combination therapy called Smoothglo by Lumenis. So if you have questions, you can give us a call. Clinic's closed today, but we'll open back up at 8 a.m. So give us a ring. It's Summer Skin Rescue, and we're offering the best savings because prices are changing. So we want you guys to capture savings for this year. So hope you all have a great day, and we'll be back for more. We're doing an Instagram Live, I believe it's next week, near the end of when Summer Skin Rescue concludes. So have a great rest of your summer and early fall, and we'll be in touch. And I hope you enjoyed seeing my face get blasted, because I did.